left pinky toe. So I would do that because that's a good way to learn not only the names of the vessels, but how they connect to each other. Okay? And I would try doing that. If you want me to check it, I'd be very happy to. Maybe we should do that as an extra credit. Let's do that as a 1 point extra credit.
1 point?
1 point.
5.
Oh, come on. No.
Come on.
1 point extra credit.
Okay, 1 point.
You'll see. It'll be enough. With all the laps and everything, it'll be good. 1 point extra credit. Okay. This looks familiar to you. This is a frontal section of the heart showing the structure of the internal chambers. We can see our 2 atria. Number 3 is the right atrium, 10 is the left. 5 is the right ventricle, 12 is the left ventricle. We see our 4 valves. Here is our tricuspid valve, number 4. The cups, the chordae tendini attached to the papillary muscle, and then of course bicuspid valve, chordae tendini, and papillary muscle. Right between the 2 ventricles, we have our septum, interventricular septum. And then we can see the 2 semilunar valves. 1 here, number 6, is at the entrance to the pulmonary trunk. And over here, number 13, the aortic semilunar valve at the entrance to the aorta. We can see our veins that are bringing blood to the heart. Superior vena cava, bringing blood to the right atrium. Inferior vena cava, bringing blood to the right atrium. We also have, where's our pulmonary veins, which, right there.
Yeah, 9.
Wow, no, but let's go to the, okay. Pulmonary veins going to our left atrium, and then our coronary sinus, we just see the opening to it. Remember, blood from coronary circulation collects in that big thick vein at the back, coronary sinus empties into the right atrium here. And then leaving the heart, it's a little bit easier. We have blood leaving the right ventricle through the pulmonary trunk to the pulmonary vein, and then from the left ventricle, blood will lead through the aorta into general circulation. Okay. Yay. And here, again, is the dissected heart, which you can also see in lab. I just want to mention one other structure. If you look at the wall of the heart, the lining of the wall of the heart, we can see papillary muscles extending off the ventricle. But you can also see these lines here. These are called trabeculi, and they are just, they actually are underneath the lining of the heart are going to be some nervous tissues that are part of the conduction system of the heart, and these trabeculi contain fibers called Purkinje fibers. We'll talk about those in a little bit. Just so you know, the trabeculi are actually these kind of, what would you call them, lattice work, and they lie just underneath the inner lining of the heart, the endothelium of the heart. On. Okay, here is our anterior view of the heart. We've seen this before in lab, and this is showing you our coronary circulation. Here is our right coronary artery and our left coronary artery branching into the descending interventricular and the circumflex artery, bringing circulation to the heart, right? And then, of course, the venous return will all go into the coronary sinus, and I'm just going to skip over a lot of these because we've already done all of this. We see here our large coronary sinus. This is a posterior view of the heart, okay? So this is a large coronary sinus, and venous return from the heart tissue will end up in this coronary sinus, and it will all be dumped into the right atrium. This has been incorrectly labeled. This should be left atrium, and this should be right atrium. Somebody labeled it incorrectly. Okay, let me skip over all these. Yay. Okay. All right, let's talk about how this heart sits inside of our chest, inside of our thoracic cavity. We can see here that the heart actually sits on top of the diaphragm. This is our diaphragm right here. In fact, it rests directly on the diaphragm. So that's why when people have, and the stomach is right underneath here. So when people have really acidic stomach and reflux into their esophagus, acid reflux very often is referred to as heartburn, because that burning sensation occurs not only beneath the heart but behind it, which is where you find your esophagus going down to your stomach. And you see the apex of the heart right here, and here's the base of the heart with the great vessels. If you remember, the heart is going to be surrounded by a membrane called the pericardium, right? And it sits in the thoracic cavity between the right lung and the left lung. Each lung also is surrounded by a membrane, and the right pleural and the left pleural membrane. And above the heart, the great vessels, the trachea and esophagus are all in a space right up here called the mediastinal space, the mediastinum. Okay? Now, I want you to notice how this heart is positioned. Okay? We have the base of the heart here. The heart is actually twisted and turned so that if you were to lie somebody down flat on the table and just bring your eyes down to the level of their chest and look at their chest, you can actually observe their chest going up and down with every heartbeat. That's called an impulse point, where you see the chest going up with every heartbeat. And that impulse point is caused by the apex of the heart hitting the anterior chest wall every time it contracts up. So the apex of the heart right here is what hits the chest wall. So that's the most anterior portion of the heart. Okay? That means the deepest portion of the heart is going to be the base of the heart. Okay? And the anterior of the heart is going to be the ventricle, and that means the posterior, or the deepest portion of the heart will be mostly the atrium. Okay? So if someone were to be stabbed, for example, the effective way to actually stab somebody is to just go under on the left side, under the rib cage, right, with a knife. I mean, isn't this like a Marine maneuver or something? You just like get them right under the rib cage and it goes right into the heart. In this direction is one of the most effective ways to silently kill. And but look what it does. It actually slices open. Well, there's very little bone to get in the way because you're going underneath, and you get through the diaphragm so they have difficulty breathing, and then you go right into the ventricles, which bleed out very rapidly. So it's a very effective way to kill somebody. But you can see you're going right and cutting right into the ventricles with that method. So stab wounds to that area, and even gunshot wounds too, you have to be very careful about what structures are underlying. All right, let's look at the pericardium and the layers of the heart. Okay, we know that the heart wall itself is made of cardiac muscle tissue. Okay, remember that there are some specific characteristics of cardiac muscle tissue we'll get into, but this is showing, this pink area here is the cardiac muscle tissue that makes up the wall of the heart. It's called the myocardium, okay? Now, the heart is lined by simple squamous epithelium. This is the innermost layer of the wall of the heart. The simple squamous epithelium is called the endocardium. Now, we actually looked at the layers of blood vessels, right? And we saw all blood vessels are lined by this simple squamous epithelium, but we call it endothelium or tunica intima. Well, it's the same stuff lining the heart as all of the blood vessels, but in the heart we call it endocardium. Okay, so it's endothelium that lines the heart, but we call it the endocardium rather than the tunica intima. And then we have the middle layer, which is the cardiac muscle tissue. And then outside of that cardiac muscle tissue, the outer layer of the heart wall is going to be called the epicardium. The epicardium. Now, the epicardium is actually the innermost layer to the membrane, the serous membrane that surrounds the heart, the pericardial membrane or pericardial sac. So the epicardium is the inner layer to that serous membrane. The outer layer to the serous membrane is going to be the parietal pericardium. Okay, do you guys remember serous membranes from AMP1? That they consist of 2 layers and the space in between that has some serous fluid? Remember that? Okay, so this is our pericardial membrane with our parietal layer and our visceral layer. The visceral layer is always right next to the organ, always right next to the organ. The parietal layer is further away from the organ, and in between a little bit of serous fluid. Okay, the visceral layer of the pericardium is is actually the epicardium, the outermost layer to the heart. So it serves two purposes, so it has two names. Okay? So if you were to go through from inside to outside the layers of the heart, we would have the endocardium, made of endothelium. We would have the myocardium, made of cardiac muscle tissue. We would have our epicardium / visceral pericardium, connective tissue. We would have our pericardial space with serous fluid, and then we would have our parietal pericardium. Okay, and that's the layers from the inside of the heart all the way out. Okay. Now, why do we have this serous membrane around the heart? Well, very simple. Serous fluid is lubricating. And the heart, when it contracts, is constantly getting smaller and larger and smaller and larger as it beats. It's moving violently in that chest. And because it's got so many other tissues close to it, the heart and the diaphragm and everything else, all these blood vessels, every time it moves, it rubs against all those other tissues. And that rubbing together builds up heat. That is friction that builds up heat. Having this serous membrane around these structures, the serous fluid will actually absorb any heat that has built up, and just having the fluid there reduces the amount of friction that can be produced by the movement of these organs. So it will reduce friction, reduce the buildup of heat, and we can find that sometimes people can actually get a viral infection. A viral infection that can affect the various layers of the heart. Sometimes a person may get a viral infection or even a bacterial infection that infects, well, let's say it's called endocarditis. What layer of the heart do you think that infects?
The endocardium.
The endocardium. What if somebody had pericarditis? What do you think there is infected?
The pericardium.
The pericardial layers. Usually the serous fluid inside becomes infected, and the layers of the pericardium become swollen. When that happens, you get all this fluid accumulating, lymph fluid accumulating inside this space right here, and what it does is it constricts the heart. It's like the pericardial membrane forms a really tight vice around the heart, so it's unable to beat freely. And it's very, very painful, and the person ends up actually having their heart squeezed until they die. That's what pericarditis is. Okay. All right. Cardiac cycle. Okay. Cardiac cycle tells about all of the events that occur in one heartbeat. Okay? And one heartbeat takes very little time, like 28 seconds or something like that. And we can actually list in sequence about 5 events that occur in the cardiac cycle. But the first thing we want to do is we want to look at the 2 main states that the heart can be in. Okay, and that's what we have listed here. These 2 terms, systole and diastole. These refer to 2 states that the heart can be found in. The term systole is actually the state of the heart in contraction. So when the heart is contracted, when all of the muscle fibers are contracted, that is called systole. Okay, we can actually specifically say when the ventricles are contracted and when the atria are contracted. We can describe that as ventricular systole or atrial systole. But systole refers to the state of contraction of the cardiac muscle tissue. Diastole is the state of relaxation, just the opposite. So when the cardiac muscle fibers are relaxed, usually the chambers tend to be open and ready to be filled with blood. This is referred to as diastole, and it is a condition of being relaxed. Okay, so those are 2 conditions, and you'll notice that these 2 words are also used in taking blood pressure. Yeah. And they both refer to a reading that is taken at a time when the heart is either in a state of contraction or a state of relaxation. When you take your blood pressure, it's usually 2 numbers. There is an upper number, which is your systolic, and then the lower number, which is diastolic. The systolic number tells the blood pressure, the pressure inside the blood vessels when the heart is contracted. And the diastolic number tells you a pressure in the blood vessels when the heart is in a relaxed state. And you can actually look at the difference between the two numbers and play with them and come up with other indications of the state of the heart. But systole and diastole refer to the state of contraction or relaxation that the heart will be in. Okay? And those are states that it will be in the cardiac cycle. All right, now let's look at the major events in the cardiac cycle. We'll see 5, I believe, yes, 5 events that are listed here. And we're going to start with what we call the quiescent period. This is a very, very short period of time. This is where we're going to start. Okay, but in essence, you can actually pick any point in which to start your cardiac cycle. Really, you can start from the point of the first heart sound or the second heart sound, but in this case we're starting with the quiescent period. Okay, the quiescent period, quiescent means quiet, and this is a point where the whole heart is in diastole. All chambers are relaxed. All chambers are in diastole. There's atrial diastole, there's ventricular diastole. All of the chambers are relaxed and open, and blood is filling up the heart, particularly the atria. Okay? At this point, blood is coming in from veins. It's coming in from the superior vena cava and the inferior vena cava and the coronary sinus and filling up the right atria. Blood is coming in from the pulmonary veins and filling up the left atria. From the atria, the blood will flow through an open AV valve into the ventricles. And even though this period of time is quite short, about 70% of the ventricles are filled. 70% of the capacity of the ventricles filling occurs at this point in time. So the heart fills up really fast. Blood actually just gets dumped into the heart from all those veins, into the right and left side. It's dumped into the atria, and then it immediately leaves the atria through the open AV valves and fills up the ventricles. Okay? Now, at this time, our AV valves are open, but our semilunar valves are closed. Okay? So just remember that, all right? And there is a reason for that. And, whoops, I am sorry. Let me just go to my heart image really fast. I want my open heart image. Here we go. Let's look at this one here. Okay? Now, here we have our veins coming in and bringing blood into the right atria. We have the pulmonary veins bringing blood into the left atria, okay? And if this were the quiescent state, our AV valves will be open and blood will immediately travel through the AV valves and start filling up the ventricles. And the ventricles will be 70% filled by the end of the quiescent period, okay? The semilunar valves should be closed. And there's a reason for that, because when the heart is in diastole, all of this muscle relaxes and the heart kind of like just slabs like that, just kind of slabs, and the spaces, the chambers open up to receive blood, okay? And what that does is when they open up to receive blood, it causes a little bit of suction. So blood isn't really just forced from the vessels into the heart. When the heart is in diastole and it opens up, it's like creating a suction, a vacuum inside the heart, until blood is actually being sucked in from the veins. And if these semilunar valves weren't shut, blood would be sucked in from there as well. So those semilunar valves have to be shut, because the negative pressure inside the heart would cause blood to come in from the arteries. Okay. Now, once we're more graphs, don't get scared. Okay. Once we're done with our quiescent period and our ventricles are 70% filled, then we have to fill them the rest of the way. So now we're in the second event of the cardiac cycle. In order for that last 30% of blood to get pushed into the ventricles, the atria now have to start going into systole. So the walls of the atria, and only the atria, start to contract, okay? And what that does is it forces whatever blood might be in the atria at that time, it forces it into the ventricles, okay? When the atria contract during atrial systole, the last 30% of blood will be forced into the ventricle. Now the ventricle is pretty much 100% filled to its capacity, okay? And at that point, the atria start to relax, and this event number 3 and event number 4 occur at exactly the same time. When the atria start to relax, when you start having atrial diastole, because they've done their job now, they've pushed the last 30% into the ventricles, then the ventricles will start to contract. So atrial diastole and ventricular systole occur at the same time, okay? Ventricular systole, when that starts to occur, the myocardium of the ventricles begin to contract. When the wall starts to contract, a number of things happen. The tension on the chordae tendineae of the AV valve is loosened, and the AV valve cusps are able to snap shut. When they snap shut, you get your first heart sound. So during ventricular systole, when the ventricles contract, that's when the AV valve shuts and you have your first heart sound. When the ventricles contract, it also forces the blood into the great vessels, into the pulmonary trunk and aorta, and into circulation. When the blood is forced into those great vessels, it causes the semilunar valves to open. Okay? So you have to kind of imagine all of this happening. I think I might have a video somewhere. I'll look for it. Okay? So ventricular systole, it occurs at the same time as atrial diastole. Ventricular systole, the ventricles start to contract, the AV valve snaps shut, first heart sound, blood is forced into the great vessels, semilunar valves open, okay, and blood is forced into the circulation, okay. The contraction lasts for like 0.2 seconds, and then everything is forced out of the heart, and now the heart can relax, and we have ventricular diastole, the last event in our cardiac cycle. The cardiac muscle of the ventricles are now going to relax. As soon as they start to relax, the walls expand open. The expansion of the wall, remember, the papillary muscle is actually part of the ventricular wall. When the wall relaxes and opens, it pulls on the chordae tendineae, it causes the AV valves to open. Also, that slight suctioning will also cause the semilunar valves to snap shut, and that's where we have our second heart sound. Okay? And this is where we begin to have our quiescent period again. Because remember, we had atrial diastole just before, and now ventricular diastole. And for a really short time, atrium and ventricles will be relaxed at the same time, and 70% of the heart will be filled. So we go from ventricular diastole back to the quiescent period. Okay, so that is our cardiac cycle, and I'm going to stop here because I want to find a video where we can just see it go. Actually, the events occur one after another. Okay, so any questions about our cardiac cycle? We're good? All right, why don't you guys take a break? I'm going to go look for